public sector doctors affiliated with the body from the 31st of March 2021. And I did mention earlier on that we have joined us from our Abuja studios, Dr. Jerry Sogun, Secretary General of the National Association of Resident Doctors. Once again, Dr. Sogun, so nice to have you on your town.
Yeah, thank you very much for having me this morning.
I think it's a lot better now. So, how far is your body going with the planned strike action? Has anything changed? Are you still embarking on the strike?
Thank you once again. At this moment, everything is still the same as it were. However, I must tell you that we don't like to go on this strike. It is not in our character to just jump up and want to go on strike. So I think I need to inform the public at this point what is leading to the strike as contained in our communique that I believe you have. Sometime in January, we gave an ultimatum on several issues, which included that at this present time, the hazard allowance of doctors that are working, confronting COVID-19 in this country is just 5,000 naira monthly. And we feel that that is preposterous. It is highly condemnable, and I believe you agree with me. So we have written severally to the government, we've had interface with them, that they need to review the hazard allowance of doctors to review it upwardly. We have proposed that it should review it to 50% of the consolidated basic allowance of doctors, and that can be calculated for different cadre of doctors, and it will amount to different amount. We are aware how many doctors are leaving the country every year because of poor remuneration, poor service condition in this country. So as a body, when we came on board, we decided to talk to ourselves, encourage ourselves, because if everybody leaves the country, who will treat my sick parents? Who will treat my brothers and sisters? Who will treat your brothers and sisters in the country and yourself? So we feel that everybody cannot leave. For those of us that have decided to stay, let's encourage ourselves. So this present dispensation decided to come up with several packages that can encourage doctors to stay. One of them is that we're doing keying into the federal government housing scheme, and we are providing houses for doctors in this country. Just as we are trying to do all of this to encourage ourselves to stay, we have our younger colleagues, the very key component of the medical workforce in this country, the house officers, who have been working. This is not just, it's not as if they are just employed. They have been working. Suddenly by January, they stop their salaries for fault of that is not theirs. You know, I must tell you, because I like to inform the public rightly, there is a policy that came on board that, you know, house officers should be centrally distributed across this country. This was, you know, the idea of, you know, Nigerian Medical Association and in collaboration with the then Minister of Health. And I must tell you that the federal government approved this in 2017, but to our dismay, you know, this policy has not been implemented. And even when they want to implement it by December, when the circular came out, as a body, because one of our aims and objective is to look into any policy, any proposed policy that will affect medical training and services in this country. And when we looked at it and we felt it's a good thing, and we supported it. But as we speak, because of that poor implementation of this policy, doctors that have been working since January till now have not been paid. So I must tell you that this strike is a distraction and is something that is condemnable. We didn't want it, but you will agree with me that you cannot work for 3 months without salary. Just yesterday, the meeting we had yesterday is obvious to us that even with the threat of this strike, the people that are supposed to implement this policy, the people that are supposed to just put papers together, sort out things and pay people's salary are still running around without knowing what to do. And it's so sad that we are where we are today and nobody is taking responsibility. So it's a sad thing, I must tell you, that this strike is going to owe. There are people that must be held responsible, not the association. I'm really very emotional right now that we are going to go on strike because of issues of people's growth, people that are not doing their job, gross irresponsibility of some persons in office that have refused to do what they should do. What does it take to put papers together to pay people? Is it news that we have these doctors working? Are they saying that they are not working? They cannot say so. They have the papers with them. They've confirmed that they are working. Just to pay them, it's taking them 3 months. I must tell you that if we didn't declare this strike, these people will continue to work. They will even work for more than 6 months without pay. And it's sad. It's preposterous. People should be called to book.
Here this morning to shed more light on what is actually going on and why we think government is still holding back in fulfilling the promises made to you. But you respond to that after this very short break. Dr. Isogun there is the Secretary General of the National Association of Resident Doctors. We take a very short break. News Hub continues after this. Put a question before the break, Dr. Isogun. You say, is it from 31st of March or 1st of April? Can we have some clarity there?
Yes, the strike will start on the 1st of April because the ultimatum elapsed on the 31st, 12 midnight of March.
March, all right, now the question that I put across to you, let me bring it back on. Why do you think government keeps relying on the agreements they've reached with the association over time, especially in this particular case?
Yes, I must tell you that it's clear now that government, people in government are not responsible. That is why when they have agreement with people, the citizens of the country, they seem to renege on the agreement. You know, one of the issues that we raise on our communique is the fact that government has have agreed with us since 2017 on several issues, but till now nothing has been done. Issue of hazard allowance is still they are not saying anything about it. We have a law that has been passed that should enhance residency training in this country, the Medical Residency Training Act. Because when you see doctors leaving this country, some of them leave this country because of the rigors it takes to train to become a specialist in this country. So the government has approved and put into law a law to guide residency training and to fund the training. As we speak, it's just on paper. Sometime last year, the fund was released, and since then, a lot of issues have come up. This year, we have not heard anything, and these doctors go for exams 2 times in a year, and they spend money out of pocket, out of the little salary they are being paid. So we have come to ask for universal domestication of this act, not just domesticating it. We want it to be backed with funding, proper funding. And at this point, I think I need to mention that there is a dichotomy here. When there's a law of the federal government, the state government, they don't key into it. And we have doctors working in the state. We have people staying in the state. So if you don't key into it and you leave the doctors there to be working in with poor remuneration, how do you encourage them to stay there? So we have come to ask for universal domestication. Let this act be domesticated across the country and be backed with funding so that residence training can be seamless. That is one of the issues we have with the government. And we think that a responsible government will be able to call the state governors to order, to ask them to key into the law, because it seemed to be the right way to go. That was why the law was passed. So if we are in the same country and we are saying that the state governors have autonomy, because of that they will not key into it, then it's sad. But I must say that some state governments have done the needful. At this point, we must enforce it to all state governments to do the needful, so that our doctors in this country, because we see the same patient, we are equal. Patients are the same. So we cannot say that those in Zamfara State are different from those in FCT Abuja. It's the same work we do. So this law must be universally domesticated. The other issues we have is that, you know, training, people go for training because there's no infrastructure in some institution. You know, resident doctors are being stagnated. So there is this new policy. There's a policy now where if you don't have certain infrastructure in your place, you go on outside posting to go and work, to go and acquire that training. We have come to realize that our different CMDs are starting doctors that want to train and become better in their career. There are different exorbitant amount being taken from our members across the country. So we have come to the federal government, who is the employer, to abolish that, because these doctors are already working and rendering services to wherever they go to. So what they call the bench fee that is being taken from doctors and in an haphazard manner should be abolished. We feel that if doctors have to go to another place to acquire services, they are already passing through stress. They have been displaced from their families. There's no provision for accommodation and other psychological stress that they will go through. And upon this, they are still made to pay exorbitant amount. This is discouraging. This is one of the reasons people leave the country, because it's not like that elsewhere. Then there's something I need to mention. There's still another group of doctors, as we speak, that have been working for 4 months. These people have been employed because of inefficiency of people in government that are supposed to capture them into the IP system for them to be paid. They have been left there to be working for 4 months. And as we speak, they will continue to work if nothing is done. So these are the issues these are the reasons why we have decided to declare this strike. Let people come together and do their work. And those that have refused to do their work should be called to book.
If you can hear me,
yes.
Are you saying, since the calling up of the strike action by your body in 2020, that the federal government hasn't done anything with regards to all of the agreements reached with you?
Nothing has been done. I must say, I can tell you that for a fact. Nothing has been done.
Absolutely nothing. No salaries paid, no wages paid since 2020.
As we speak, salaries have been paid. We are working. We are not asking for increment in salary. They are paying salaries of doctors. But I just identified 2 groups of doctors. One of them is the house officers, who have been working, and suddenly, because of the new policy that was supposed to be implemented in December, precisely January this year, because of the policy, their salaries have been stopped. For 3 months now, nothing is being done. The association initially, because we have faith in the policy, we decided to follow them. We had faith that the whole process will not take a long time. So we decided to allow them to do their job. But as we speak, in fact, it is sad to say that they are not doing what they should do. And they've left our members to be suffering for 3 months for no fault of theirs. Then the other group are the residents that have been employed that are still in gift list. They are supposed to be migrated to IPs, which is the new system of payment of salaries of all workers. Who is supposed to do the job? Is it the workers? Well, they've been punished for fault of no theirs. So that is why we are here. They are supposed to be paid. What we ask for is that they should pay their salary. This is not increment in salary. Pay the salary of our members that have been working. Pay the salaries. And if they have done this, we will now sit down to talk of other issues that are in that communique. The other issues are issues that concerns poor remuneration. As we speak, hazard allowance is 5,000. It is appalling. It's not something that you can tell anybody. There are people taking hardship allowance of 1.2 million in this country. Are they better citizens? Doctors face all sorts of hazard, from COVID-19, from Lassa fever, from yellow fever, from HIV, you can name them. And the hazard allowance is just 5,000. I think it's preposterous. It's sad that we have a country like this. We have so many doctors in position.
How we get this clearly? There is a report that your association is still in dialogue with the federal government. And as we speak, you are still in talks with the federal government. How true is that? And if you're still in talks with the government, why embark on a strike action?
We have not embarked on a strike. The strike is going to commence on the 1st. It is because we are in dialogue. That was why we gave ultimatum. The ultimatum is actually to make a responsible government to sit up. I can tell you for a fact that we were in talk with a government official yesterday up till 10 p.m. yesterday. But they are just addressing one of the issues, which is the issue of the house officers. Even in that meeting, it was clear to us that if not for this strike, these young ones would have worked for more than 6 months without them being paid. Even as we speak, it is not clear if they will be able to sort out the issues. As we speak, they are still sitting down now trying to sort out issues that they would have sorted out long before now. So it's sad to us. If this strike will go on, it is not because we like to go on strike. We have opened the window. We are still here. We are still talking with them. We are telling them what to do to avoid this strike, and I think they know what to do. If they can be approving 1.6 billion naira to revamp a debt refinery in Port Harcourt, what does it take? What does it take to pay people's salary? I think we should all of us should come together and that's the government, because if people die from this strike, the blood of Nigerians will be on the agencies of government that are supposed to handle these issues that are not doing their job.
Dr. Isogun, you said that you were still with the federal government representatives as at yesterday night up to 9 p.m. Yesterday now up to 9 o'clock.
Yes.
To sort out all that happening. What have you been able to deduce from perhaps the body language or what they're saying as to if they're willing to provide all the requests you made of them as agreed upon in your last pact with them? Is there anything you see happening in the next 24 hours that could change your stand of planning to go on this strike?
That is left for them. As we speak, like I told you, yesterday we were just addressing one of the issues, and which is the key, very key and important aspect of this whole thing, the payment of our house officers. But it's not very clear if they will be able to sort out those issues and have all of them paid. If you have read our communique, we said all the house officers that have been currently working, they should be paid. What it takes to verify their status is not in our hands. We have thrown it open for them. Go and do your job and pay them. So for us, we are open. We believe that if they do what they should do, the strike will not hold. But it's not in our hands. We didn't want to get to where we are. We didn't want to do that because we don't like strike. But where we are now is in the hands of government. If the strike will not hold, it's in the hands of government. So if I must tell you, from the meeting of yesterday, an aspect of the strike is being addressed, but we don't know if they will be able to sort it out. So we are waiting.
Can this say that we are still in a state of deadlock as we speak? Let's say government doesn't come through with your expectations. What are those services you plan to withhold?
It's a total and indefinite strike. Total.
The ICU units, the emergency, medical emergency, and what have you, are you shutting down everything?
It is a total and indefinite strike, ma'am.
All right, so, but the good news would be that if before the end of the day, the federal government decides to do the needful, it means that everything will be okay. Is that what you're saying? And even moving forward, many Nigerians have always wondered how it gets to a point where you go to negotiation with the federal government and you don't get the commitment from them before calling off your strike and calling off your strike action. Are you taking a look at dealing with governments moving forward from now? How the better way to go about it? Is your association considering anything in that regard?
No, you just raised a very important point. You know, when you are on strike, we are all humans. We have feelings for our patient. In fact, nobody likes to go on strike. That is why when we are negotiating, we tend to want to come to a compromise, and we don't want to continue on the strike because of our patient. So when we do that, come to a compromise, and want to have an agreement and call off the strike, government, they will not be responsible to follow up and fulfill their promises. So that is why we keep on going on strike again and again. And at this time, we have decided to say that, apart from the payment of the salaries, let us put everything that are, bedeviling the sector of this country together. It is not news anymore that doctors in this country are poorly remunerated. So we say that let us improve on the remuneration of doctors. Let us improve on the working condition of doctors in this country. We don't want all our doctors to leave the country. And that was why, as an association, as a body, we have decided to take it up upon ourselves, to encourage ourselves, use our money to key into the federal housing scheme. And as we speak, we have launched the phase in Oka, the one in Abuja I just started work. These are the things we are doing to encourage our doctors so that we can stay. But it's sad that government is not encouraging us. This strike can be avoided. This strike can be avoided. So if they have met the agreement they reached with us since 2017, we will not be talking like this. Who would have known that till now the housing allowance of doctor will still remain 5,000 naira? This is not the first time it's been raised. What stopped the government from calling the leadership of the doctors together and say, let us deal with this issue? And they are collecting hardship allowance in the House of Assembly and everywhere. And they are leaving the doctors to suffer. It isn't because they want doctors to leave this country, because the government officials don't assess healthcare in this country. As we speak, we just hear all over the news now that the president of the country is jetting out of the country for medical care abroad. It is sad. If we improve the healthcare in this country, we will be able to assess better healthcare in this country. That is what we fight for.
Dr. Jerry, we have to go now, unfortunately. We speak with Dr. Jerry Sogun, the Secretary General, Nigerian Association of Resident Doctors, LARD. Dr. Sogun, we want to thank you so much for all that you do, for all your patience across the country, your selflessness, and for your love for everyone. I want to thank you so much. I will wish you the best in your negotiation with the federal government. Hoping I won't see this strike action coming to pass. Thank you so much.